Hello, my name is Phil Burke, and I am a physician assistant at Variety Care, and I'm currently the director of HIV and viral hepatitis services. I'm going to talk to you today about what happens if you test positive for HIV, as well as a little bit about treatment for HIV. So let's start with what if I'm positive. If you test positive, the first thing that is important to know is that HIV is no longer a death sentence, as long as you get in and stay in care with an HIV medical provider. There is currently no effective cure. Once people get HIV, they have it for life. But with proper medical care, HIV can be controlled. People with HIV who get effective HIV treatment can live long, healthy lives and protect their partners. Contact your PCP or an HIV provider as soon as possible after learning about a positive HIV status or diagnosis, so that an appointment can be made for you. Additional lab work may be needed to confirm HIV diagnosis if the original HIV positive notification was found through a rapid test or from OBI after donating blood. Once HIV is confirmed, if needed, additional blood work will be needed as part of your initial HIV workup, which may be completed by your primary care provider or an infectious disease specialist. So is there treatment? There is effective treatment for HIV and AIDS. Anyone who is HIV positive should be placed on medications for HIV called antiretroviral therapy, or ART, as soon as possible. First thing we'll talk about as far as treatment is something called rapid start. So it is very important for anyone to start on ART as soon as possible after being diagnosed to reduce overall inflammation in the body. Rapid start is normally when we start someone on ART or HIV medication within 7 days. But definitely within 30 days and hopefully get them linked into care. So next I'm going to talk a little bit about treatment as prevention. So treatment as prevention, we know that the longer someone is HIV infected and not on treatment, that it's easier for them to spread the virus to others, whether unknowingly. So the idea is if we get someone on medication quickly and get their HIV viral load controlled and non-detected, then they cannot pass it on to anyone else. So there are multiple single tablet regimens available for HIV treatment. So 1 pill a day, which has changed from previously when sometimes patients had to take multiple pills 2 or 3 times a day with multiple side effects. Overall, the medicines are much cleaner than they used to be, which is easier for the patients to tolerate. Depending on whether your HIV infection has any resistance mutations, single tablet regimens may not be available, and this should be discussed with your HIV medical provider. ART medications, or HIV medications, need to be taken daily, ideally around the same time of the day, to make them the most effective. The goal is always not to miss any doses, so establishing a daily routine around medication administration is very important. Missed doses can lead to development of resistance mutations, which, if they occur, can cause modification of your ART regimen and possibly make it impossible for you to be on a single tablet regimen. In addition, some other medications, including over-the-counter products and vitamins, can interfere with some of your ART medications, so make sure to discuss with a medical provider before starting any new over-the-counter or prescription medications to avoid potential drug-drug interactions. And lastly, once in care with a medical provider and on ART, it is important to maintain regular care and follow-up with your provider for your overall health, as well as to avoid potentially running out of HIV medications. Once you're in care, stay in care. Variety Care currently offers HIV testing, prevention, as well as treatment. If you have any questions about HIV, you can visit our website at www.varietycare.org/UYOU or www.cdc.gov/HIV. Next up is Dr. Kate Arnold, the Director of Women's Health at Variety Care. She will be giving some final closing thoughts.
Hi, I'm Kate Arnold. I'm the Director of Women's Health at Variety Care. Thank you for trusting us to discuss HIV with you. We know that this can be scary. We also know that as a patient, it's tricky figuring out what you need and what clinic to go to. Everyone in this video cares about you. That's why we've done this. We all believe that the most important thing is you, our patients, feeling comfortable to seek out care. And we don't care if you come to our clinic or someone else's, just as long as you come to a clinic. Please reach out to any of us. We've heard it all and are comfortable taking care of people of any race, any gender, any sexual orientation, insured, underinsured, or uninsured. Even if you're not ready to stop high-risk behaviors such as IV drug use or unprotected sex, we can help you avoid HIV. You have the power to stop the spread of HIV in Oklahoma. please take the next step in protecting yourself and your loved ones by calling one of us to make an appointment.